Poor blood circulation and blood clots in the legs aren't just uncomfortable, they're dangerous. For seniors, they can lead to chronic leg pain, skin discoloration, frequent swelling, numbness, and in severe cases, deep vein thrombosis or even a deadly stroke. But here's what's truly alarming. Most seniors think these symptoms are just a normal part of aging, something you just have to live with. And yet, that couldn't be further from the truth. Because in many cases, poor leg circulation and blood clots don't start with aging. They start with something far more manageable, a deficiency in key nutrients. And if caught in time, these deficiencies can be corrected, often leading to significant improvement or even complete reversal, simply by taking the right vitamins. As Dr. Michael Lin, a renowned regenerative medicine physician and vascular health researcher, once said, "The vast majority of vascular conditions don't begin in the arteries, they begin at the cellular level with what the body is missing." That's why in today's video, we're going to uncover 4 powerful vitamins that have been shown to dissolve blood clots naturally and restore healthy circulation in the legs, especially for seniors. Before we begin, please hit the like button and subscribe to the channel. That one simple action helps this video reach more seniors who may be suffering in silence and don't yet know that there's a natural, effective path to better circulation. Let's dive in. Before we get to the 4 powerful vitamins that can dissolve blood clots and restore circulation, it's important to first understand the warning signs, because many people miss them until it's too late. So here are 5 common signs that blood clots or poor circulation may already be affecting your legs. Sign 1: swelling in one leg. If one leg suddenly becomes swollen, especially around the calf or ankle, and feels warm to the touch, this could be a serious warning sign. Why one leg? Because blood clots often form in deep veins, typically in one leg at a time. It might look like normal swelling or fluid retention at first, but if it's persistent or painful, it could be deep vein thrombosis, DVT, which needs immediate attention. Sign 2: cramping or pain that gets worse when walking. You might chalk it up to just getting older, but if your legs start to ache, cramp, or feel tight when you walk, even short distances, that could be a sign of peripheral artery disease. This happens when narrow or blocked arteries restrict blood flow to the muscles. Pain usually improves with rest, but that doesn't mean the problem is gone. It just means the muscles aren't being starved of oxygen in that moment. Sign 3: skin that looks shiny or discolored. Pay close attention to the skin on your legs, especially your lower legs. If it starts to look glossy, unusually pale, bluish, or reddish, that may indicate poor blood flow. In some cases, the skin may also feel tight or develop patches that look like a rash or bruise. This is your body's way of showing that oxygen and nutrients aren't getting where they need to go. Sign 4: frequent numbness or tingling. Now imagine that happening regularly, even when you're not sitting awkwardly or crossing your legs. This kind of persistent numbness or tingling, especially in the feet or toes, is often due to reduced circulation or nerve stress from a lack of blood flow. If left unchecked, it can progress to nerve damage or ulcers. Sign 5: cold feet or legs, even when it's warm. If your legs or feet often feel cold to the touch, even when the rest of your body feels fine, it could be a sign that blood isn't circulating properly to your extremities. In a healthy body, blood flow helps regulate temperature, especially in the legs. But when arteries are clogged or constricted, your limbs may be starved of warm, oxygen-rich blood. These signs might seem subtle at first, but together, they point to a deeper problem with your circulatory system. Now the good news is that in many cases the body can begin to heal once we correct the underlying nutrient deficiencies that are preventing blood vessels from functioning properly. First vitamin, vitamin E. Now let's talk about another powerful vitamin that can make a real difference in dissolving blood clots and restoring leg circulation in seniors, vitamin E. But not just any vitamin E, there's a right form and a wrong form, and getting this part wrong can do more harm than good. Vitamin E is often referred to as a natural blood thinner, and for good reason. It helps prevent platelets from clumping together, which is exactly how blood clots begin to form. It also protects the delicate inner lining of your blood vessels, called the endothelium, from oxidative stress. This protection keeps arteries flexible, improves blood flow, and reduces the risk of plaque buildup and clot formation. But here's where it gets critical. When most people hear vitamin E, they think of the common type found in drugstores, DL-alpha tocopherol. And unfortunately, that's the synthetic form, a chemically altered version that the body doesn't absorb well, and in some cases, may actually block the absorption of the more beneficial, natural forms of vitamin E. So, what's the better choice? You want to go for tocotrienols, the lesser-known but far more powerful members of the vitamin E family. Tocotrienols are natural, highly bioavailable compounds that have been shown to be up to 40–60 times more potent as antioxidants compared to regular tocopherols. But their benefits go far beyond just neutralizing free radicals. Tocotrienols actively reduce inflammation in blood vessels, lower cholesterol, improve arterial flexibility, and even help break down existing blood clots. In fact, studies have found that tocotrienols can inhibit the enzyme HMG-CoA reductase, similar to how statins work, without the harsh side effects. That means they help improve lipid profiles and vascular health in a way that's both effective and natural. If you're serious about improving circulation and preventing clots, you need to make sure your vitamin E supplement contains mixed tocotrienols, ideally extracted from annatto seeds, a rich, natural source that contains no alpha-tocopherol to interfere with absorption. But for most seniors, taking 100 to 200 milligrams of mixed tocotrienols daily is not only safe, it's one of the most powerful and natural ways to protect your arteries, improve blood flow, and reduce the risk of clots without resorting to harsh medications. Second, we have vitamin D. Most people think of vitamin D as the bone vitamin, and while that's true, its role goes far beyond bone health. In fact, science is now showing that vitamin D plays a critical role in cardiovascular health, and that a deficiency can directly contribute to reduced blood flow, stiff arteries, and even clot formation. Several clinical studies back this up. For example, a landmark study published in the Journal of the American College of Cardiology found that low levels of vitamin D were strongly linked to a higher risk of heart disease and poor circulation, particularly in older adults. Another study from the American Journal of Clinical Nutrition showed that vitamin D improves the function of the endothelium. That's the delicate lining inside your blood vessels. Unfortunately, most seniors are unknowingly walking around with insufficient or deficient vitamin D levels. And the biggest problem? The recommended daily allowance is just 600 IU a day for people over 70. That's far too low to correct a deficiency, especially in someone whose levels are already depleted. To put it simply, 600 IU is like trying to put out a house fire with a spray bottle. It won't make a meaningful difference. If you truly want to see improvements in blood flow, reduce clot risk, and repair vascular function, most experts now recommend between 2,000 and 5,000 IU of vitamin D3 daily. But there's a very important warning here. Taking high doses of vitamin D3 alone, without pairing it with vitamin K2, can actually make your circulation worse. That's why vitamin D3 and K2 must always be taken together. They work as a team. Vitamin D increases calcium absorption, and vitamin K2 guides that calcium to the right place, your bones, instead of letting it clog up your arteries. Experts suggest that the ideal ratio is about 1,000 IU of vitamin D, 3 to 10 micrograms of K2. So, for someone taking 5,000 IU of D3 daily, at least 50 micrograms of K2, preferably in the MK7 form, should be taken alongside it. This combination has been shown to dramatically improve vascular flexibility, reduce arterial plaque buildup, and help prevent dangerous clot formation, especially in the legs, where blood tends to pool and stagnate with age. Next we have vitamin C. Would you have thought that vitamin C, the same one many people take for colds, could actually help dissolve blood clots and improve blood flow in your legs? It might sound surprising, but research shows it plays a powerful role in maintaining vascular health, especially in older adults. Vitamin C supports the production of collagen, which is critical for the structure and elasticity of blood vessels. Without enough collagen, your arteries can become weak and stiff, setting the stage for poor circulation and clot formation. A study published in Free Radical Biology and Medicine found that vitamin C helps protect the endothelium, the inner lining of blood vessels, from oxidative stress and inflammation, both of which are key drivers of clot development and poor circulation. But here's what most people don't know. Not all vitamin C is the same. The majority of supplements on the market use synthetic ascorbic acid, usually derived from GMO corn. While it might raise your vitamin C blood levels temporarily, it lacks the natural cofactors like bioflavonoids and enzymes that help your body absorb and use it effectively. Natural sources of vitamin C, such as Indian gooseberry, also known as amla, camu powder, acerola cherry, and rose hips, contain these beneficial compounds. Lastly, we have vitamin B3, niacin. Would you believe that one simple B vitamin could dramatically improve blood flow, clear out clogged arteries, and even help dissolve dangerous blood clots? That vitamin is vitamin B3, also known as niacin, and for seniors struggling with poor circulation in the legs, it can be a game changer. Vitamin B3 has long been studied for its ability to increase HDL cholesterol, the good cholesterol that helps sweep away plaque from artery walls. A major study published in the New England Journal of Medicine showed that niacin significantly reduced cardiovascular events in high-risk patients, thanks in part to its ability to improve lipid profiles and vascular function. But that's not all. Niacin also dilates blood vessels, a process known as vasodilation, which enhances circulation to the limbs, especially important for seniors dealing with cold feet, tingling, or leg cramps due to poor blood flow. It works by increasing nitric oxide and prostaglandins, which help blood vessels relax and open up. This is why many people experience a niacin flush when they take it, a temporary warm red sensation as blood vessels expand. But not all niacin is created equal, and sustained-release niacin is something to be very careful with. While it may reduce the flushing effect, studies have shown that sustained-release niacin can lead to liver toxicity, especially at higher doses. That's why it's better to avoid sustained-release forms, unless specifically prescribed and closely monitored by a doctor. For most people, especially seniors, the safest approach is to stick to natural food sources like turkey, tuna, liver, peanuts, and sunflower seeds. If supplementing, experts advise taking no more than 50 to 100 milligrams per day, unless instructed otherwise by a healthcare provider. Higher doses can stress the liver and may interact with other medications. It's also important to understand that even a mild niacin deficiency can worsen circulation and contribute to fatigue, brain fog, and inflammation. That's why ensuring a steady, safe intake from food or low-dose supplements is so important. Before we wrap up, here are 3 quick bonus tips that can also help restore circulation in your legs naturally. First, cut back on refined carbs and sugar. These trigger inflammation and damage blood vessels over time. Second, stay physically active, even if it's just a daily walk. Movement helps keep blood flowing and prevents pooling in the legs. And third, stay well hydrated. Dehydration thickens the blood, making circulation slower and increasing the risk of clots. That said, it's incredibly important to consult your healthcare provider before adding any new supplement to your routine, especially if you're managing other health conditions or taking medications. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to the channel for more informative videos like this one. Thanks for watching, and take care of your health.